My name is Guy Felicella, and I'm the peer clinical advisor for the BC Centre on Substance Use out here in beautiful Vancouver, British Columbia, Canada. We're going to talk about safer regulated drug supply, criminalization, legalization, and the stigma that just surrounds it all that we're trapped in. And in order for us to move forward, the majority of society looks at, drug users as some sort of social scourge, some form of social evil, but it's not. It's, in fact, trauma is the motivating factor in substance use and addiction for many people out there. And so we have to actually look at things differently. And right now, in where I'm from, in British Columbia, Canada, we have toxic drug supply and a public health emergency that's killing people, 6 people actually, every day in British Columbia. Roughly across Canada, there's about 14 people dying every day. And in the last 4 years, there's been over 16,000 deaths in Canada alone, and climbing at an alarming rate, and it's due to the contaminated drug supply. And one of the things that I'm very outspoken is about a safer regulated drug supply of diacetylmorphine, injectable hydromorphine, and possibly powdered substances, because in British Columbia, we're noticing that 41% of our drug users who are dying of a drug overdose actually smoke the drugs, and 28% inject the drugs, and then the rest are doing them orally. We have, obviously, COVID-19 has compounded everything, made drug supply chains dry up. The drug supply has gotten increasingly more toxic day by day. It's so unpredictable. And in the last 3 months, first time ever, we've had more than 170 people die every single month. And it's egregious that this government continues to, address the urgency of COVID, but that same effort and urgency in responding to the overdose crisis that's not only ripping apart families, communities, brothers, sisters, mothers, fathers, and people that work in the field, and drug users especially, that same urgency needs to be implemented in the overdose crisis. I just recently did a TED talk on, is safe supply a viable option for the overdose crisis? And this, I believe, is one of the ways that we can remove the stigma that surrounds drug use, also with decriminalization. Decriminalization would allow people to not be punished for struggling with their substances, but also if society is looking at, getting people off drugs, then maybe we should start with giving them safer regulated drugs to start, to get them off the toxic street drugs. Because these drugs out here are so contaminated and so saturated. Our concentrations of fentanyl are unbelievable. And every year, the challenge in BC and across Canada is that heroin doesn't exist. And if it does, it's very challenging to find. And so, you have drug users that have now been transitioned over to fentanyl. And it's really, people always ask me, it's like, well, how did this happen? And I said, well, organized crime and economics is really how it happened, is that they don't care about people, they care about money. And heroin, just the profit margins, the size, the loads are easily intercepted. Fentanyl is a lot smaller, a lot more 100 times more powerful than heroin, which means for the price of about $15,000, where you can mix it with other compounding agents, you can turn it into, millions and millions of dollars worth of profit. And so this is just what's happened. And then obviously with the dark web, it's become, increasingly easy to access fentanyl, and it's really what's replaced the drug supply out here in Canada. And interesting enough is that there is some prescribing programs out here that benefit. These are pilot projects. We no longer need pilot projects for things. We can only look to Switzerland, what the UK did in the 70s as well with the diacetylmorphine programs, to know in fact that they actually do work and actually change people's lives. We have roughly 200 people on diacetylmorphine programs across the country. And here's the stark numbers though. We have almost 18,000 deaths and only 200 people can access this. And really what the challenge is the UN and US sanctions, the drug policy that only allows a certain allotment of heroin to make it into each country, is that we can't get any more. So one of the things that we need our government to do, and every government should be doing it around the world, is work with a domestic supplier and immediately scale up diacetylmorphine so that there can be local programs across the country, across the world, to actually transition drug users to come into a supportive environment. Because right now, what any government in the world is saying is that we don't support drug users, but we actually support organized crime. And we need more public to be behind to say, this is not right. These organized crime syndicates are making hand over fist off people struggling with substances, and we're paying billions of dollars in taxes to fight the war on drugs that's not working. And in Canada, I don't know what it is in the UK, but every dollar spent, every taxpayer dollar spent on addiction treatment saves $13 taxpayer money. I mean, there's the facts of the simplicity of it behind it, is that, oh, and we would actually help people. And you know, when people see the homeless populations venturing into communities and people get fearful, the public gets nervous, they see people injecting drugs or doing drugs, and you know, you have your kids. Well, I have 3 kids too. And I take my kids all over the city, in the downtown east side as well, where I grew up. I don't want my kids to be fearful of a bubble, but I honestly believe this, that if we had a safer, regulated supply of drugs to give drug users, we would actually have safer communities for everyone. Meaning, people wouldn't have to do what they have to do every day to get their drugs. And really, we spend a heck of a lot of money on health costs, justice costs, in order, and it's not working. I mean, it hasn't worked. You know, and one of the things where I always talk about is that when you hear overdose or opioid or drug addict or these words, your mind gravitates to the drug user that's made visible to us through their struggles with poverty, homelessness, and mental health. That's not the case. Addiction knows no bias, no gender, no race. It can hit you at any time. It just picks and chooses. And if that's you, the majority in Canada, so we have 200,000 people that could be homeless at any given point in our country. But 6 million people will develop a substance use disorder in their lifetime at some point, meaning the data doesn't support. This is an everybody issue. We have so much stigma that surrounds it. And in British Columbia, right now, 80% of the people dying of an overdose are dying alone. That tells you that the system is failing people. And why are people using alone? Well, I'll tell you why. The same reason why I didn't reach out for many years of help and support is because how I was looked at, how I was judged. I didn't even leave a community in a 2-block radius for 20 years because of the way society looked at me, like I was some sort of piece of garbage or an animal. And it's very challenging that we as a society believe that we want to help people get better, but we only support them when they're off the drugs. And knowing that this is a chronic relapsing condition, we don't support them when they're using the drugs. To me, I don't know any other health condition that we would do that to. It's almost if somebody had cancer and then it went away, but then it came back, we'd be like, oh, how dare you have that again? We would never do that. So why does our society continue to do that for drug users? And unfortunately, not everybody that uses drugs is addicted to drugs, but everybody that uses drugs is at risk of overdose and death. And we need to really look at how we address substance use and addiction, because right now, our society is creating more addiction. People say the harder the enforcement, the harder the drugs. Well, I say the harder the drugs, the harder the addiction. And if we look at creating a safer, regulated drug supply where people can have access to drugs such as diacetylmorphine, stimulants, and other substances in a facility that actually works with people, sky's the limit. I've watched it change and shape many people's lives. And sometimes, you know, when we're looking at poverty and homelessness, we always believe that people need to get off the drugs first. Well, getting off drugs doesn't solve homelessness either. We have such complex issues, and we have the lack of support from all our governments across the world to address these issues. And until that part changes, this is going to continue to become more and more, and not only this generation. I want people to think about also the generation in the rear view mirror. People are going to fall into addiction, and allowing overdose to continue doesn't eliminate addiction. It will continue to move forward, and generations will be impacted. And until we actually look at creating a system that supports people instead of punishing people, and remove the systemic barriers that have been in place since the beginning of time, people will continue to die, people will continue to struggle, and nothing will change. And I always say this to the public: if pointing fingers and yelling at people that are using substances changed anything, it doesn't change a thing. It just keeps people trapped longer and longer and longer. And until we actually do that, we're going to be running with this for many, many years. And so my big thing is, right now, the most urgently needed harm reduction intervention is a safer, regulated drug supply for everybody. And that would also mean, I'll reiterate, a safer community. Thanks for listening.